Hello there, lovely people. So I try to raise a lot of awareness of the conditions called PANS and PANDAS, and I do this to try to allow people to see if they may have been misdiagnosed, as unfortunately it is often misdiagnosed, and I do it so that people can see whether they may have traits, and if they have traits they could get into contact with a PANS-PANDAS specialist. But some people may wonder, so what is so bad about a misdiagnosis? Is there really an issue in getting a incorrect diagnosis if it still somewhat explains the symptoms? So I'm going to explain why it is actually important to get the correct diagnosis. So the main reason why it's important for a person to get a diagnosis of PANS or PANDAS, if that is what they have, is because it is managed differently to the conditions which it is often misdiagnosed as. For example, it's often misdiagnosed as Tourette syndrome, but the interventions for Tourette syndrome often won't work as well for PANS or PANDAS. Not all the time. Sometimes the medications used for Tourette's tics can help people with PANS PANDAS, however, it's not going to address all symptoms that people with PANS PANDAS may have, and PANS PANDAS is typically managed/treated with interventions such as antibiotics, anti-inflammatories, and other immune modulating interventions. So for the best symptom reduction, people do need the correct treatment that target their brain inflammation and any underlying infections if there aren't any, such as Lyme disease. Another misdiagnosis is often FND, functional neurological disorder, and again, FND isn't managed with antibiotics or anti-inflammatories, so people are not going to get appropriate symptom reduction if they are given the incorrect diagnosis. As well as this, getting the diagnosis of PANS or PANDAS allows people to know why it's so important to be vigilant of infections, because once you have that diagnosis of an autoimmune disease, you realise how important it is to prevent infection, because it can have a really bad impact on you. And having the diagnosis helps you explain to people why you need them to tell you if they have an infection so that you don't go near someone who has an infection. Having the diagnosis of PANS or PANDAS, if that's what you have, can also allow you to understand your experiences more. For example, there may be certain symptoms that you have that can't be explained by the diagnosis you were originally misdiagnosed with. So, for example, I'm diagnosed with Tourette syndrome, autism and OCD, but I more likely have PANS, and I got a throat infection which not only led to the sudden return of OCD, which if I didn't know about PANS PANDAS I'd be very confused as to why that happened, it also caused loss of sensation and loss of coordination, and those are things that don't actually match up with the diagnoses I was originally given. So having the diagnosis of PANS or PANDAS allows you to understand why you flare with infections, why your symptoms can change, because symptoms can change in each flare if you have PANS or PANDAS, and can explain just certain symptoms that are more common in PANS or PANDAS, like dilated pupils, separation anxiety, and things like coordination changes, for example.